And welcome back. We are getting ready to do a Duke laser disc repair, lumbar L4-5, on a patient who has had disc pain at L4-5. That's his worst pain. He also had thoracic pain. We just finished his thoracic Duke laser disc repair. And Jordan, you want to show us where the L4-5 disc is? That's correct. So that's where I'm headed with my needle. We're headed right there. Now he's a thin young man, so he doesn't have a lot of excess tissue. So his spine is not too far forward. All right, looking good. How is he doing, B? All right, we're almost there. You can see the needle at the L4-5 disc. AP? Oh, we will. Thumb it up, Luis. Let's go. All right, we just checked the x-ray from the front back. It looks good. From the side, it looks good. That is the L4-5 disc. I'm going to enter it with the needle. We're going to do a quick discogram, and then we're going to do our laser procedure to repair this disc. This disc is causing his back pain he's had here for many years. Shot. There it is. Next, I'm placing a guide wire to guide my dilator. We've already numbed the skin up. Okay. I'm going to make a 7mm incision. Last time for the thoracic we did a 4mm. This is a 7mm. The difference is that the scope we use for the lumbar is a 7mm scope. The sheath is 7mm, sorry. Shot. Taking the needle out. We're going to run the dilator down the needle. This will spread the tissues. One of the advantages of this treatment over all other spine surgery is there's no damage to any of the soft tissues, a knife, because the only thing we're cutting is the skin. That's it, nothing else. Blot, blot. It's just fucking light. The skin incision is 7mm. None. Everything below the skin is not cut, it's spread. Spreading is different than cutting. In surgery, you do two things. You can spread or you can cut. Cutting causes scar tissue, inflammation, damage. Spreading does not. If you spread tissues, you can do it in an atraumatic fashion, so you're not causing trauma to the tissues. Then you don't get bleeding, you don't get scar tissue, you don't get much pain at all, and the tissues heal quickly. Shot. The dilator is a spreading instrument. Now we're entering the disc right through the tear. So some people ask me, don't you cause damage? Nope, we're not causing any damage because we're going through the part of the disc that's already damaged. Wait. Henry, let's show the audience that there are 30 different causes of back pain, the disc being the most common.
Copy that.
Shot? Looks like it's, okay, there we go. I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Majan. Thanks for joining us. Welcome back. So Henry, we've watched 30 causes of back pain.
Correct.
And of course, after watching it, you all understand the disc injuries are the #1 cause of back pain. That's what we're fixing right now. We just finished fixing 2 thoracic discs on this patient. T78, T89 on the right side. It went very well. Now we're fixing his lumbar. And I was just complimenting his mom from Canada and him and their family, the father, how supportive they were to this child. You know, it's really unfortunate, but a lot of people with chronic pain, everyone believes that they're faking it. They're just trying to get pain pills, trying to get marijuana or alcohol. They don't understand how impactful pain can be. And the doctors are so worthless for the most part because they don't explain to the family, yeah, your pain's coming from the disc or the facets, because the doctors have no clue where it's coming from and they don't care. They just say you're going to have pain the rest of your life, live with it. And that message they give to the family at that point is, your child is in pain, but he's kind of nothing we can do. And it delegitimizes pain. It delegitimizes pain. And that's a very important, look at the granulation tissue. It's a very important concept that a lot of people overlook. People living in pain understand it, they live with it. But it's humiliating, dehumanizing to live in pain, to not be able to live life, to not be able to have a full life, to not have relationships, not have activities and sports and hobbies because you're in too much pain. And thank God his family is loving and understanding, and they believe him, and they trusted him, and they got him here to Duke Spine, and we're now going to cure his pain, and he's going to have a very different life. He's going to have a normal life.
We have a question
Yep.
coming from, forgive me if I'm pronouncing this wrong, Javin on YouTube,
Hi there. Welcome to our stream.
asking how long till you notice pain relief following the surgery?
This surgery for the laser with the disc, the people notice immediate pain relief. Typically, they will, when I go talk to them in recovery, 50% will say, yes, the pain is gone. I have a new kind of pain, a new pain from the surgery. Of course, when we hammer that metal stick in your body, it's going to hurt, right? So we're going to give you some pain in your muscle because it's going to be aggravated from the surgery, but that's a different kind of pain. And half the patients that we do the surgery on, in the recovery room, they will say, the pain is gone that I came here with, but I have a different kind of pain. The other half will say, I can't tell. But by the next morning, 95% of them say, yeah, the pain is gone. I feel great. Everything is gone. I didn't take any pain pills last night. I feel wonderful. Thank you so much. It's a miracle. So 95% of the patients, the pain is gone by the next morning after surgery completely. Not just the pain from the discs, but also the pain from the surgery. And they take no pain pills, by the way. Zero pain pills. They take Tylenol. That's it. Tylenol is not really a pain pill. We're almost done here. 5% of the patients, they leave the next day, and within a few weeks or a few months, their pain is gone. But we've never had the surgery not work. Okay? The only time we've had a problem is when we give the patient the diagnosis of, say, 2 or 3 discs. Let's just say they have four painful discs, but they only want to fix 1 or 2. Then they're still going to have pain because they didn't do everything we told them to do. And that's the only time we've ever had a problem. Patients who come here and they choose not to do everything we tell them, and they end up still having pain in that part of the body where they did not treat, even though we told them they needed to treat it, that's the only time we have a problem. And a lot of those people end up coming back and getting fixed the rest.
We have another question
Sure.
coming from Rusty on Facebook,
Yes, Rusty?
asking, can a leftward protruding T8 to T9 disc herniation cause pain in the whole rib cage, sternum, and left shoulder?
No, the T8-T9 disc herniation will not cause shoulder pain. The T8-T9 herniation will not cause sternum pain. It can cause bottom of the sternum pain, but not middle or top of the sternum pain. And the best thing for you to do is to do an MRI review with us. It's free. We don't charge. It's 100% free. And I will tell you where your pain's coming from. But it requires not just an MRI, it requires me to do an exam. I have to look at you and see where your pain is. And I have to have you push on some areas to help me, check for tenderness. Tenderness is very important in diagnosing the cause of pain. I'm almost done. This is a very firm herniation. Almost done. There's a lot of scar tissue in this one. This is L4-5. All right, we're pretty much done here. We'll just take one quick look. All right, guys, see the tear? That's where the herniation came out. Clean it up. And then there's going to be a nerve root right up here in that fat, right in there. That's where the nerve root is, protected and away from this. But you see why the herniation's right next to the nerve root? The inflammation gets on the nerve root. All right, great job. We're going to move on next to a rhizotomy. Any more questions?
No current questions.
All right, thanks for joining us. We're going to end the stream and come back for a L4-5 rhizotomy, Duke plasma rhizotomy.